Okay, here is a case called disseminated intravascular coagulation, microthrombi, microinfarcts, kidney. I think we could recognize the fact that we have a kidney here. I think you can also notice that the glomeruli seem to be standing out quite a bit in that they seem to be a lot redder than usual. I think you can also possibly realize the fact that the cortex looks like in many areas, especially here in the tubules, that it has lost its delineation of cellular detail, uh, like you see in infarcts. But also notice how these glomeruli seem to be quite red. And why do you think that might be? Well, let's zoom in on one of the glomeruli. And you'll notice that not only does it seem to be very much congested, but it seems like the glomerular vessels are also filled with some granular red material as well. Well, if you were to do a stain which is fairly specific for fibrin, called an MSB stain, which stains fibrin nice and brown, you will notice that fibrin is accumulating in all of these glomeruli that look red. These are not just hyperemic glomeruli, they are filled with fibrin. They are filled with fibrin because this is a DIC case, and basically many small vessels in the body are forming clots. This is also called a consumption coagulopathy because it consumes fibrinogen, and platelets. And this is a pretty striking example as to why those glomeruli look congested. It's not congestion, it's actually small thrombi within the glomerular blood vessels. And it also explains why the other parts of the cortex, noticeably the tubules, look like they have lost their nice nuclear and uh, cytoplasmic differentiation, and that's because they are infarcted. So there are multiple microinfarcts and even larger than microinfarcts throughout this renal cortex on the basis of small thrombi occurring possibly everywhere in this person's body, and most noticeable in this case where we see thrombin infarcts chiefly throughout the glomeruli. And thank you very much.